Growing up here in Tasmania, mental health just wasn't, as it probably was in most places, spoken about amongst men. Growing up, you hear a lot about suicide. It was quite confronting, and it sort of pushed me to consider, that could be my brother, it could be myself.
Men in Mind is a world-first evidence-based training program which is focused on strengthening up the workforce and their response to men's mental health. What we know from the evidence is there's a short window of opportunity for practitioners and for men. We know that men are not met with a perceived sense of safety and trust. They may disengage, and we're seeing high rates of that dropout after the initial session. So Men in Mind provides practitioners with a toolkit that they can draw on when engaging men at different points in the mental health system.
For me, the first part of the Men in Mind was to really reflect on my own practice and really reflect on my own understanding, your own upbringing and how that affects you as a practitioner. Your words are super important. You need to be thinking clearly, but also come across as natural. You need to be genuine in your role.
As a young female, I had some anxieties about working with men. They might look at me and be like, what would you know about me and my life and my story? I had to challenge those thoughts. That's what motivated me to learn more about men's health.
So Men in Mind's helped me and my patients embrace masculinity in a healthy and productive way. It really prompted me to consider intersectionality. We don't often consider that when we meet with people. We consider what we see, but we don't often consider all the different contexts and the systems in their lives.
The program has changed how I engage with men. Language is the most powerful tool we can use. How we frame things up, how we build connections, how we collaborate is the first step in keeping men engaged.
So in this partnership with the Tasmanian Government, what we're seeing is practitioners are talking about increased confidence and skills in responding to men. We're very fortunate to be building connections across the state, to talking to practitioners that are using the training. And so that reciprocal process and the partnership will allow us to really create a health system here that best responds to men who are seeking support.